Okay, Alison, thank you very much for joining us. Today we will be having a little bit of recording to share your story, your experience, and we have prepared a few questions.
Sure.
And firstly, what we have here is if you could introduce yourself, tell us a bit more about you. That would be great for us to have a background.
Okay, sure. My name is Alison, and I have a spinal cord injury, C6-C7 level. From what I understand, it's more at the C6 level. It was a compression injury, so my C7 vertebrae moved out of place and into the C6 area of the spinal cord. But both were involved, so yeah, C6, C7, and yeah. So what was the rest of the question?
Just tell us a bit about your condition, but I think if you're comfortable to share, may we also know what was the cause of injury?
Yes. So yeah, it's an incomplete injury. But mostly the incompleteness is mostly sensory, you know, and yeah. So yeah, the short version is that yeah, I had a fall from a horse, so a riding accident, and yeah, the horse went up because of something going on outside of where I was. And I got, like, she went up on her back legs and I got hit in the face. So then I lost consciousness and I just, you know, slid down. And since I was not conscious, you know, I had not really any control of my body, and I just, you know, slid down and off. And yeah, that's how I got the injury.
Can you tell us how did you learn about epidural stimulation?
So yes, I do a lot of research online, and you know, of course, I look at, you know, clinical trials, studies, you know, potential treatments, cures. Well, there is no cure, but you know, possible treatments, and you know, something I can do, and I found it online. Yeah, I had seen it, you know, I guess quite early on in my injury, but at that time, you know, I wasn't really keen on getting a medically implanted device, that I wanted to try to recover as much as possible naturally. And, you know, then, okay, you know, you get to a certain point and you hit a plateau and you don't really go beyond that plateau, or it's difficult. And so that's when actually I saw, I think it was in a Facebook group, so something online, someone who had been here, you know, posted some videos, and so it made me think about it, you know, again a second time. And I thought, okay, well, why not? You know, I've come so far, and you know, I've gotten this far, and I'm not really making any more progress. You know, why not? You know, why not try it? And so then I actually reached out to her, and she was kind enough, you know, to take the time to speak with me. And you know, I saw a lot of the testimonials and videos from other people online, and I thought, okay, well, this seems, you know, it seems promising. Why not? You know, why not give it a try?
Yes, and I think what I'm also happy about is, you know, what I'm hearing is you're not just waiting for, you know, for the implants or whatever. You're also doing a lot of training and rehabilitation.
Absolutely, yes, yeah.
Yes.
Yeah, I do as much as I can, you know, so every single day. And yeah, I mean, with the device, I think the more you use it and the more you do with it, the better, and the better the results are.
So you arrived in Thailand late last year around September, correct?
Yes, it was like the very, very end of September. Yeah, so it's been 5 months, you know, since I've had the implanted device.
And can you share with us a little bit about your impression with the team?
Oh yeah, everyone is wonderful, excellent. I mean, the therapists are all really, really good. You know, they're super specialized in spinal cord injury and also too, I mean, okay, the whole mapping process and the stimulator, this is quite a complex, you know, complex process, but they're really, really good at what they do. And the whole staff, you know, I mean, the medical staff was excellent. They were really, really attentive, you know, always there, you know, they support you, and everything was really, really well organized. I mean, we basically arrived and everything was planned out for us, you know, so it makes it really, really easy.
Well, I'm very, very happy to hear that. And before your arrival, what were your expectations prior to undergoing the surgery?
Yeah, I guess I try not to set my expectations too high, you know, because I don't want to set myself up for disappointment. So I guess that I didn't really have any, okay, yes, you know, you want improvements, and I guess I just don't, I'd rather set the bar a little bit lower and then, you know, instead of setting it so high and you know, not reaching that. But I guess that I didn't really, okay, yes, I hoped to be able to, you know, be able to stand and to take steps and you know, move my legs with the stimulation, but you never know, you know, so I just, I honestly, I didn't really know what to expect 100%.
Right. Since you stayed with us, I think, for 35 days plus 2 weeks?
Yeah, it was 7 weeks. I know that my first stay, it was 7 weeks altogether.
With all those exercises, do you have a favorite exercise?
Oh yeah, stepping for sure. Yes, because it feels really good to be up, you know, upright, vertical, and taking steps, you know, like before. Okay, not exactly like before, but that's definitely my favorite exercise.
So besides the exercises, are there 3 things that you like the most here?
Well, I mean, I like the way that everything is structured, you know, like the therapy, and I think that it's what we do, the exercises we do, and the way it's structured is really, really good. I mean, yeah, okay, the people, the therapists and the staff are excellent, you know, are really, really, really good. Everyone is really, really good, and it's, you know, everything is really well organized, and yeah, I really like the breakfast buffet at the hotel.
The hotel as well.
Yeah,
So
the hotel is good.
Yeah, kind of like a combination of hospital and the hotel. Yes, especially during the first
Oh,
few
yes.
days. And yeah, what I'm hearing is, or maybe you can share your comments about the accommodations.
You mean the hospital
Both.
or both? Oh yeah, no, I mean the hospital, this was fine. I mean, we had a big room. The room was large. Yeah, I mean, okay, very accessible. The nursing staff is really good, you know, really, really good. Yeah, we had a nice view actually in the hospital of this temple. Yeah, it was nice. So this was really, really good. Yeah, the hotel is also very, very good. I mean, I think this is a 5-star hotel. I don't know, you know, so the accommodations are, yeah, and the room, you know, here at the hotel is really accessible, you know, bathroom is very good, also very spacious, a lot of space, you know, it's easy to go around everywhere in your wheelchair. Yeah.
Yes, we, as much as we can, make as comfortable as possible. So I'm very happy to hear about that. So your treatment comprises of epidural stimulation, stem cell, and a lot of mapping and rehabilitation. Yeah. We talked about the epidural stimulation. What about the stem cell? How is the stem cell treatment?
As far as the procedure itself, or
yeah, procedure, what you've experienced when you had it, and
oh yeah, it was easy. I mean, so I did it when I was at the hospital, you know, so I was still in, you know, my hospital stay. No, it's really easy. The doctor came up to the hospital room and yeah, my room, and yeah, it was really simple. I mean, stick the needle in, bing, that's it. And there, I mean, I had no complications from it, no side effects, no headache, no nothing. I mean, okay, you know, you lie down, well, what is it? You lie down like a couple of hours afterwards. No, it was really easy.
The stem cells was October, correct? And
yes, because I think that I had the surgery first, so that was very end of September. And then, yeah, stem cells, I don't remember if they did it 2 treatments in 1 week, or maybe it was in 2 weeks. I don't know, I don't really remember, but yeah, it was, that would have been October when I had the stem cell treatments.
Since then, what, do you see any outcomes so far?
Yeah, I mean, I know that my hand function has improved, you know, a little bit. I don't know if that's due to the stem cells or, you know, the electrical stimulation. Let me see, some of the improvements I've had, you know, without the stimulation, you know, like, I mean, there are some exercises I can do now that I couldn't do before, and this is without the stimulation switched on. I don't know if it's, you know, from the stem cells or the stimulation or the combination of both, you know. I mean, I'm sure they work together. And I mean, that's why I did the stem cell treatment also, because I wanted to, you know, use this, yeah, you know, whatever I could, you know, maybe that combination, or get the most out of the stimulation. I thought maybe the stem cells would help, you know, this combination of treatments. So yeah, that's why I decided to do it, to get the most out of, you know, the treatment itself.
In the next few months, we'll be able to maybe reassess and
yeah,
see.
Yeah, of course. Yeah, I think it's still pretty early too.
Yes. Right. What else? 3 things. If there's only 3 things that changed most significantly after the epidural stimulation surgery.
3 things. Only 3. Okay. Well. Okay. The ability to move your legs. You know, with the stimulation on, for sure. Yeah, because I mean, before or without it, I can't, you know, move my legs. Yeah, this time around we found some really good programs for stepping, you know, standing. So now I can lock out, you know, both my legs to be able to stand. So, okay, I have to go home and keep on working on it and practice and everything. And with my stepping, my left leg, I mean, I can take like a normal step, you know, pick the leg up, put it down, and then lock it to stand. So it's like, okay, I don't have it on the right side, but it's like a normal step, you know, like a normal person will step. So that was definitely pretty cool. Yeah, you know, my blood pressure is definitely better. So without the stimulation. You know, I've had definite improvements in my blood pressure, and I don't know, I mean, I haven't really tested this out yet because I mean I live in a cold climate, but I know last time I was here I was like starting to sweat like on my head and neck and chest, and that you know, I had not done before since my injury. So yeah, I have to see when it's hot, you know, where if I start sweating in more places, but yeah, I'll have to see. Yes, yes.
All right. And what about your bowel and bladder functions? Are there any changes you've seen?
No, this I haven't seen any changes yet with this.
All right. And how is the medical care different from the healthcare back home?
Oh boy, oh yeah, well, I know that, yeah, the surgeon who performed, you know, the operation, he was really, really good, and, you know, even afterwards, he came to check up on me. So, I mean, at home, the surgeon will never go to your hospital. And you know, he's the one who also took my staples out after the surgery. I mean, this is at home, no one, you know, the surgeon will not do this job. This is not a job for the surgeon. So, you know, after the surgery, I saw him several times again. And so that was, you know, he was interested, you know, about, you know, how I was doing and my recovery thus far, and yeah, very, very good. And then also, you know, after I had the operation, Dr. Nasir and everyone is keeping an eye on, you know, your wound and how you are, you know, make sure that everything looks good, and everyone is really, 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 really attentive, you know, and they deliver really, really good care. You know, also, I mean, the nursing staff, when you're in the hospital, I mean, if you need something, they're there right away. I mean, you don't wait an hour, you know, for the nurses to come. So very, very, very good, quick and really attentive.
What would you say about the Verita Neuro team, or for example, at least the therapists?
Well, about what? Sorry.
The team, especially the therapists.
The therapists. Oh yeah, I mean, they're really, really good at what they do. Really, really specialized in spinal cord injury.
How many therapists did you work with?
Well, because I had, you know, my head therapist. And then, yeah, I worked with a few of the others, you know, also. So, yeah, you know, yeah, because a lot of times there will be another therapist assisting too, you know, your head therapist. So, oh yeah, I mean, I worked with a lot of them. So a lot of them, no, they're all really, really good. Really, really, really good. Oh yeah, I forgot to mention, yeah, one other really good thing about this is probably better, yeah, with the improvements, is also the spasticity program that I have on my, I mean, I use it every night, you know, and it takes away spasms so that, you know, I don't have to take spasm medication anymore. You know, this alone is, oh yeah, really, really, really good. A really good feature.
Yes, yes. So not many people knows that, you know, how the typical day looks like. Maybe they think that it's just surgery and it's done. So maybe you can share how your regular day here looks like.
Oh yes, there's a lot that goes into it, and no, and I think too with the stimulation you have to use it a lot. You know, you have to train with it a lot, and you know, yeah, because I was here 7 weeks, end of September to mid-November, and now I came back end of February for, you know, a couple weeks, and I can already see, you know, there was a big difference and there was a lot of progress, you know, since then. So I think you have to train with it a lot, use it a lot. And then, yeah, I think you set yourself up for getting better results. But no, yeah, we train a lot every day. So yeah, when I'm here, I mean, we wake up at 6 in the morning, you know, to get ready, go down, have the wonderful breakfast here at the hotel. And then, you know, we get picked up. And we're at the center at 9, so we start at 9, you know, for 2 hours of mapping, and then 1 hour PT, and then an hour lunch, and then 2 hours of mapping again. So, you know, it's that's, yeah, 5 hours of, you know, doing therapy, exercises, mapping in a day, and I think that's what's necessary. You know, you have to keep that up too, or try to, you know, when you go, as best you can, when you go home. So yeah, it's intensive therapy, you know, every single day, you know, with mostly using the stimulation, you know, but then also a little bit without, but very intensive.
Sounds like hard work, everyday hard work.
Yes, but it's worth it. It's worth it.
Yes. So how soon after the surgery did you start to see changes?
Yeah, well, I mean, the first time they switch it on, and then, you know, you start, you know, trying to, you know, move your legs, and yeah, it was, yeah, I don't know, a couple, 2-3 days after the surgery where we started with the mapping process, and you know, then when you start to be able to move your legs again, yeah, a little bit, you know, trying to figure things out so quickly. This part, you know, is yes, so quite quickly.
Or after 3 days you see some movements.
Yes. I mean, there's a lot more that goes into it. You know, there's a lot of exploration, you know, within the whole mapping process, and trying to, you know, figure out different programs that get, you know, certain results. Lengthy and requires a lot of patience, but yeah, no, you start to see quite quickly, quite, you know, quickly after the surgery.
So the question next is, was epidural stimulation worth it, and why?
Absolutely. Yes, absolutely. And you know, yeah, because I think it does give you hope, you know, and I mean, yeah, I've tried all different kinds of therapies, and I mean, right after the injury, okay, I did improve, you know, because I was also doing, you know, rehabilitation and therapy, and so I did improve, but up to a certain point. And you know, even once I reached that point, I continued, and I tried, oh my gosh, I tried, yeah, you know, osteopathy, yeah, you know, yeah, exoskeletons, oh gosh, yeah, you name it. I've probably tried it, and yeah, just nothing was really, you know, bringing me further. So yeah, you know, and I have improved a lot since doing this, so it's something that, you know, and I know when I keep working with it, I'll improve more. So it really does, you know, give you hope, and when you see the improvements, you know, then that kind of fuels it more and more. So yeah.
Well, it seems to me that you're very proactive in looking for, you know, other possible ways to try to do stuff. What I also remember is after your initial treatment with us, and then when you went back home and set up kind of a mini rehab.
Oh yes, yes. Yeah, I mean, we live in southern Germany, and yeah, there are not a lot of neuro recovery centers or centers that are specialized in that. So also we have some time, it's hard for us to go away for therapy. I mean, I still do go once a week to a therapist. And I have a therapist come to the house once a week, but only for an hour. I know that this is not enough. I need to do way more than that. So yeah, we have equipment, a lot of equipment at home, parallel bars, this e-pacer, this walker, which I used here. We found a used one online, so I was lucky to find that, on eBay. So I bought one of those. And I have another walker too. We have some equipment that we can use at home. So yeah, I have like a standing tree, but and I'm always thinking, okay, well, yeah, my husband too, he's really good at this too, that I always try to think of a new exercise or a new way of trying something or doing something. So yes, but I am fortunate that I, have this equipment at home.
Yes, it's because I believe you understand very well that it's important to continue on.
Absolutely.
Yeah?
Yeah, absolutely.
Well, for the last few questions, what message do you have for people back home who are waiting to learn about your recovery?
Waiting to learn about my recovery. Wait, I don't really understand the question. Sorry.
Maybe they're excited to learn about what have you achieved.
Oh, so you're asking like what I've achieved, or?
Maybe for people back home, for example, family member or someone with similar injury, waiting to learn more about what you have achieved.
Yes. Oh yeah, well my family, because we videotape everything, so they've seen all of the videos. But yeah, it's definitely worth, if you have the opportunity to do it, it's definitely worth trying, because yeah, I mean I can only speak for myself, but I don't want to sit around and wait for a cure. I know there are some promising some promising clinical trials or things that are just around the corner, but I mean, I don't want to wait for that. You never know how many years this can take, so yeah, if I have the opportunity to do something, to try something, I will do it.
Yes. In line with that question, or maybe statement, you've clearly come a long way. And for those who was recently injured, what advice do you have for them?
Yeah, I mean, to try, anything and everything you can. Yeah, I mean, I know it's not for the faint of heart. SCI for sure. It's really a difficult injury, but I think you have to be open-minded and do and try anything and everything. So
right, I think that's it. If you have some other message, please feel free to share.
No, I think that
that
covers it all. That covers it.
All right, thank you, Alison. I think that's it for now.